Yeah, what am I missing here?
It's like 2 under.
Yeah, there we go. Okay, hello everyone. My name is Marielle. I'm a speech-language pathologist, or an SLP, and I work in hospital settings. So today I'm going to talk to you about a little bit about what I do, and I'm going to use the piece of collaborative art that I created during Convergence, as well as the final project that I did for my science communication project, to illustrate a bit more what a speech-language pathologist does and what sort of disorders we can experience in our communication. So also, I'll mention that the timing of this presentation is excellent because May is actually Speech and Hearing Month. So we're going to learn about communication so you're ready to hit the ground running as soon as May 1st rolls around. So I work with a wide variety of patients, and the one thing that they have in common for the most part is that they have some sort of change in the way that they communicate. It could be because they have misused their voice as a singer. It could be because they have throat cancer. There's a lot of different ways that your communication can change, but because Convergence focused on neuroscience, I've focused most of my projects on neurologically based changes in communication, and specifically on changes following stroke. So about 62,000 Canadians have a stroke each year, and of the survivors, up to 40% will have some sort of change in their communication. This could be temporary, or it could be long-term and lifelong. I'm fortunate in that I get to work with patients face-to-face. So I get to work on one of the goals of Convergence every day, at least verbally. I communicate science to a patient, and I get fairly immediate feedback about whether I've done a good job or not. I can tell that with a patient following my recommendations. I can tell that by the questions that they ask. And of course, I can tell that with blank stares. So if there's a blank stare, I've done something wrong. I need to take it back and find a new way to explore the topic. That said, during Convergence, I wanted to challenge myself to work on communication of science visually. So the project that I worked on with my classmate Rochelle is called the Cookie Theft Case Studies. And it's a silkscreen series. There's 6 separate images, and they're all based on a pretty traditional piece of language assessment. It's called the cookie theft. What I would do is I would just show it to a patient and ask them to describe it, and their response gives me some idea about the changes that have occurred in their communication. So we invented scripts. They are not actual samples for ethical reasons, but they are based on different types of communication disorders. Rochelle laid them out in a nice graphic design, and then we worked together to create a visual representation of the patient's response. In my science communication final project, I've taken a little bit more of a traditional approach, making informational posters. So using the word communicate as its basis, I've altered different parts of the word to express and embody different communication disorders. So, for example, these 2 are focused on different types of aphasias, which are acquired language deficits. They can both be expressive and receptive. So, how you express yourself, but also what you can understand. And then they can be in different spheres as well. So, changes in cognition can also have an impact on the way that you communicate. People can also experience changes in their actual speech and articulation. So that's not, dysarthria, which is one of these speech disorders, is not really something that we could capture very well in the cookie theft image. So I felt it was good to represent it in this final project. So I wanted to take a couple of these final project posters and compare them to our silkscreen project, the cookie theft, just to talk a little bit more about what we're seeing. So let's start with aphasia, and in this particular case, an expressive aphasia. So aphasias are an acquired language disorder, so something needs to happen. Your language has developed normally, presumably, and then you have a stroke or a brain tumor or a traumatic brain injury. For a language deficit to occur, it would, in most people, have to occur in the left hemisphere of the brain. One of the ways that this can present is people having difficulty making complete sentences, selecting the right word, things of that nature. So let's compare it to one of our cookie theft series images. So this is the script that we created for a Broca's or non-fluent or expressive aphasia. We can see that the patient is having a very hard time creating complete sentences. Most of the words that they're using are content words, so nouns or verbs. And you can definitely tell that there's a lot of difficulty with fluency and the fluidity of their output. One thing that we're noticing too is that there are paraphasias, which are mistakes in word choice. In this particular case, the person is making mistakes that sound like the target word, so bookie for cookie, or that are related to the target word in a semantic category feature, so cake for cookie. You can also tell that the patient is very frustrated, and that is something that is quite typical of somebody with a Broca's aphasia. They have a very good awareness of what's going on, and they're very frustrated by not being able to communicate in the way that they would like. So we've represented that visually by replacing some of the target words with the words that the patient has used, and highlighting all of the different elements that the patient has attended to in color. But let's move on to the right hemisphere. So even though the right hemisphere of our brain is not typically associated with language per se, so grammar, word choices, comprehension, it is responsible for a lot of cognitive functions like memory, attention, impulse control. And if there's alterations in those cognitive functions, we are not going to be the best communicators that we can possibly be. So what I tried to communicate in this particular iteration was that loss of focus that is often common following a stroke, and having people sort of trail off and end up somewhere a bit different than where they intended to go. So here is one image in our series that represents a right hemisphere deficit. And in this particular case, the patient is quite interested in the dishes. So they've attached to one feature of the image, the woman doing the dishes, but they're having a very hard time shifting their focus, controlling impulse, and they're just listing all the things they know about dishes. And if we compare it to the original image, they're actually coming to the point where they're confabulating. They're making up things that were never there in the first place. So yes, there's a teacup, there's a plate, but there are not knives and forks and all these other things. So we can see that although this patient is very capable of retrieving words as they need them, is speaking quite fluently, they're still not a very effective communicator, and they'll need help from rehab professionals such as speech-language pathologists. One thing that I tried to bring across in both our cookie theft series as well as the final science communication project was a sense of playfulness and the human aspect of communication, because I think often we think of clinical things as being very cold and not very accessible. But the best part of my job isn't figuring out what type of aphasia a person has, it's being able to connect with patients. So telling a story, telling a joke, sitting in sadness, that's what makes my job worthwhile. So as May month approaches, I hope you feel a little bit more informed about some things that can happen with communication. And above all, I hope that you take a moment in May to think about how important your communication skills are to your everyday life, from sharing beautiful stories to doing your job. It's a big part of who you are. So thank you. And thank you to a few people, including Rochelle, my collaborator, Bettina and Christian, as well as Todd Stewart, who was who's an excellent screen printer here in Montreal, who was kind enough to lend us his studio. So check out his art. I believe it's at Bree on Instagram. Take a look. Thank you.